Well, welcome everyone. Today we're speaking with Melissa Hutchison, a leader in healthcare operations known for her work in strategic scaling and driving quality across complex organizations. Welcome, Melissa.
Thank you.
Yeah, if you would, just give us a little bit about your background and how you got to where you are today.
Well, my background is in public health. So I
Oh,
started in that arena, a long time ago now. But really had this nagging feeling that I wanted to get into healthcare. So early on in my career, shifted to kind of a um, community benefit work within a health system and started that my journey within healthcare there and spent about 14 years at large health system in my state and jumped around from a couple of different roles there. So I worked within the community benefit area and then applied research. And then I moved into kind of a value-based care operations role from there and ended my journey in that role at that health system. And from there, I went to United Healthcare, where I was working in the ACO arena, regional ACO arena. So worked with a bunch of different health systems across multiple states that were in an ACO arrangement with UHC. And then from there went into health tech, where I got to work kind of a blended um, journey where I was working with both community-based organizations as well as healthcare systems as we were trying to blend social care with healthcare. So that was really my work there. And then most recently was at another startup where we were working directly with kidney doctors and joint venture partnerships where um, we were supporting the nephrologists as they were on their value-based care journey.
oh, that's very good. Well, your background shows a clear through line in operational scaling. How did your early experiences shape your philosophy on the non negotiable elements required to scale a patient focused operation effectively?
Oh my goodness. Well, very early on, I was working in the measurement and evaluation space. That was when I was still in public health. So really
Uh-huh.
got to understand a lot about what it means to implement and drive programs, interventions, and then think about scaling it both, within clinics as well as within communities. So really being diligent about ensuring that there's a very clear way in which we're supposed to implement and then following through on that through the measurement and circling back on it, making sure that um, things were implemented as intended, that the outcomes were coming out as intended, and then adapting as needed. That was really what we needed to do to make sure that we were implementing things that were both, based on the research or, the intent, as well as like making sure that we adjusted when things weren't going the way that we thought or wanted them to go.
Yeah. How was it, the challenge there as far as trying to make sure you hit those metrics that you had set up for yourselves?
Oh, there are many challenges. I think part of it is just understanding the metrics. Sometimes the metrics shift and change as you're going through the process of implementing something. But I think also is just building the understanding with the staff and helping them understand that those metrics help drive the implementation of the work versus are punitive. So I think there's, a feeling when you're being measured on something that it can be a little bit stressful for staff, but at the same
Right.
time, it really is a picture into what you're trying to achieve and whether or not you're achieving it in the way you want to. So it was really,
Right.
I think a huge challenge was really getting past that feeling of being measured
Right.
and feeling like you're failing if you weren't hitting every single metric, that sort of thing. So that was always a big challenge, I think, when working with, um, it didn't matter where I was working, whether it was in a true public health space and community or whether I was working within healthcare systems and clinics. That was really has always been a challenge.
Right. Yeah. It seems like you were always fostering a type of culture for a
Hmm.
workflow improvement, for the managers as well as the rest of the staff. So
Hmm.
that always really helps. Gets
Hmm.
their buy in as
Hmm.
well.
It definitely does.
Um, Yeah, sure. In high growth environments, data becomes sometimes overwhelming for the
Hmm.
staff. What are some of the three or four key performance indicators that you focus on to drive clarity in that environment to help with
Um,
those inefficiencies?
yeah, I think when it comes to the high growth environment, it really does require you to be very clear about what those metrics are. In healthcare and within the value based care space, there are a lot of metrics, and they're all very important. So F I think the key is prioritizing, really prioritizing what those key metrics are and helping staff understand what are the 1 to 3 metrics that they specifically are responsible for, so that they understand that they're not trying to boil the ocean, that they're really trying to develop a system in which they
Right.
can achieve those metrics by being very focused. And maybe one day they're focusing on 1 to 2, and then once those get out of the gate and operationally that's underway, then they shift to another 3 to 4 or whatever it may be. So really, I think the key is being extremely diligent about prioritizing. There's so many that they need to achieve over the course of a year. And like I said, when they shift and change, depending on the contract that they're operating under, I think just being like to me, that efficiency comes with clarity around the focus areas. So that's key. And then we've talked about this a little bit already, but making sure that you're watching those metrics over time. So you're not just looking at them every 6 months or year, but you're really focused on making sure that the metrics are being watched over, a much shorter period of time so that you can adjust and shift and reprioritize and the things that need to be done as you're implementing this work. So those are really
Right.
two really key things from my standpoint that we did.
Yeah, absolutely. Just like to say, a journey of 1,000 miles starts with, first steps. And, same thing. They got to focus on those key performance indicators right away and
Mhm,
just get those done immediately.
mhm.
Yeah, absolutely. And then they can
And there
take
are
on as
some
they,
like, in this world, there's a number of metrics that are important
right,
at front end of the year and some that can come in toward the back end of the year, so it just sort of depends on, what you're trying to achieve, but that's the complexity of some of this work is that there's a number of different sets of metrics and a number of different timelines and all of those things, so
right.
it again, it goes back to figuring out how to prioritize at different points of the year too. So,
Yeah, absolutely. Well, Melissa, let's talk technology for a second.
mhm.
What key process innovations or technologies have you seen successfully reduce administrative burden in the clinic setting?
Oh my. I think every time I think about a technology that is to reduce burden, I think there's operational things that need to take place to make sure that it does so.
Right.
I think like though generally, um, there's a lot of good with the EHRs in terms of pulling information out that we can use from a population health standpoint, understanding, you know, from a patient level or a population health level, how people are operating and how we need to support them. There's also a set of, HIEs, the health information exchanges, that then pull information from a bunch of different sources that we use to help support what we're seeing at the more local level within the EHRs. We can see what's going on outside of that with through the health information exchanges. So those have been extremely helpful in terms of thinking about how um, patients are engaging with other healthcare in within different systems. So that's been extremely
Right.
helpful. And then very recently, just using more of these, I would say, specialized technologies that are specific to what we're trying to achieve. So there's a lot going on now in the AI space that is going to just grow and continue to support. I think it's going to get very smart about probably like a health information exchange, but pulling together a bunch of different disparate information and pulling it together much more quickly for those of us that are trying to support patients at point of care or, quickly around that point of care. So I think
Right.
there's a lot on the horizon. There just seems to be, and I imagine this will continue to be true for years to come, but lots of different things coming on the scene very, very quickly that I think also adds complexity because all of the integration of these technologies need to take place for the care coordination to take place,
Right.
which is the secret sauce, I honestly
Right.
think, um, within this world of healthcare is the integration, because we
Oh,
know that as a patient, we are a whole body, and we've got lots of different technologies focused on different parts of us, so that integration
yeah.
is really gonna be key for us to be
Oh,
able to succeed.
yeah, absolutely. And I know a lot of that, the different technologies and the integration, it comes with an administrative burden, in the clinic sometimes. And you want the staff to be able to allow to focus more on patient care. And I know
Mhm.
it's a balance. It's
Yeah,
really tough at times.
it is.
Well, looking forward to the integration of new tools, I know is critical for some, some clinics. But if you could wave a magic wand and instantly solve any one major operational headache across multiple clinics in today's world, what would that be? Do you know?
Um, from an operational standpoint, I think if I could truly wave a magic wand, it would be to reduce the complexity. Um,
Yes.
I think for me, like living within or working with clinics now, specifically, they have multiple environments they're trying to work in. They're trying to work with the patient within the room, which
Right.
is the most vital and most important, I think, for every caregiver. That's why they are in the world that they're in. And
Right.
then outside of that, they have to manage the records, which requires a lot of time on their part. And it's only getting more complex for them in terms of the amount of information that we need on kind of the administrative side to be able to manage populations and help them manage their patients more efficiently and effectively. Um, and care for their patients in the way that they want to. It does require them to engage in multiple tools. So to me, the complexity is like making sure that they understand the tools, are feeling that they're supportive of them, that it's reducing their administrative burden and offering them more time face to face with their patients, which is really where they want to be. Um,
Right.
so for me, the comple the technology that's coming on has to be, um, efficient in terms of like we talked about the integration, making sure that,
Right.
they're integrating easily, not so that the burden isn't sitting on the caregiver, that the burden is sitting on the technology. So
Right.
that's ultimately gonna be what needs to occur in the future.
Yeah, I
I
know.
think that
I've
was you
seen.
said very well, Donald. So
Right. No, that's good. I know I've seen that many times, when, they try to, add some new software or new technology into the workspace. And the employees, they don't know the why. They're like,
they
oh,
don't know the why.
why
Yeah.
are we doing this?
Yeah.
Yeah. So they need a buy-in on it and they need to understand the reason why we're looking at doing this. So I know
Yeah.
it becomes very tough at times.
Yeah, and
Um,
truly, I mean, that why is probably the basis for all operations, honestly.
right.
It
Yeah.
People need to understand what the purpose is, what the outcome is supposed to be, what it means for them, and
Right.
and then how they implement it. That really comes, toward the end of onboarding any new technology or any new change in their clinic, honestly.
Yeah, absolutely. Well, Melissa, for operational leaders aiming for quality and efficiency, what's the single most important strategic decision a leader can make right now to prepare their organization for the next wave of technological change?
The one thing, I think it is, like, truly, laying out what you're trying to achieve and identifying the technology that will fit versus, like, chasing a technology. I think it is, like I said, I think the technology is gonna come along so quickly, but you have to be very clear and diligent about what it is you're trying to achieve. And,
Right.
um, you know, asking a lot of hard questions about the technology to make sure that that's something that you can integrate and implement within your systems. Because the technologies are they can change, shift quickly and meet the needs of the end users, and I think that the operations folks need to be in the room when the decisions are being made about what the technology is going to be, um, that's gonna be chosen and being used within the work because they see the day to day. They know who the end users are. They know what their days look like. They know what their challenges are. They have heard a lot of stories about patients. And so I think it's important to have, the operations folks in the room and helping drive those decisions.
Absolutely. I agree with you completely on that. That's very good.
Mhm.
Well, Melissa, I want to thank you so much for your insights today and on the operational clarity. And this has been an incredible, valuable discussion. But thank you so much. And
Thank
I do
you.
appreciate that. Yeah.
Absolutely.
Thank you.